Well, my role really is to support students and mentors in practice. It's to really ensure a quality learning environment so that placement areas have good learning opportunities for students so that they can achieve their objectives. And it's also probably to do with partnership, and that's partnership working with NHS trusts across the patch, the independent sector, and also, of course, the university. I see our role as supporting mentors because mentors are actually the people in placement that are responsible for the assessment in practice. So we support students by supporting mentors. We keep a register of mentors in the trust. So we know how many qualified mentors we have, and we monitor that quite closely so that we have enough mentors to support the students that are coming out. We're also responsible for ensuring that mentors update on an annual basis, and we provide updates for them, in-house updates, and cover things such as assessment in practice. We look at student documentation so that mentors are familiar with the ever-changing documentation for students. We look at the curriculum, particularly the practice element of the curriculum, because, as I said, they are responsible for the assessment in practice. So by us supporting mentors, it means that we're supporting students. So when students come out into placement, they are allocated a mentor to work with, and we know that they are of the quality that we want. The mentor is key to the practice, to the whole experience of the student. They're the people that see students day to day, and they're the ones that initially, one, are responsible for the learning opportunities that students have, but also are probably first in line if there's any problems or issues. I tend to get involved really with struggling students. That's usually the time when either mentors or students would come to me, and it may be just to assist with action planning. So if there's a specific problem, we can assist with writing action plans, focusing in on a problem, unpicking a problem, looking at solutions, and perhaps looking at other resources, or resources that are actually there in the learning environment anyway, but just needs to focus in and at the end of the day help the student achieve, because that's what we all want. First placement, it's probably a bit of a shock to some students. I'm not sure whether they're entirely aware that they will be on placement and they'll be working 5 days a week, and in some placements they will be expected to work shifts and weekends, and that I'm not sure whether the penny drops until they actually get there. So obviously students come from all backgrounds, and if they haven't planned, say perhaps childcare, or some students have jobs, if they haven't planned that in, there can be difficulties, and some of those things need ironing out, and things sometimes have to be spelt out. I mean, we do actually have an induction programme for Placement 1 students, in other words, students that come out for the very first time. And in that programme, what we do is actually, sort of welcome them into the trust, but also let them know what is expected of them. So we tell them a little bit about the trust and the sort of professionals that they may, have access to, but also we deal with issues such as the importance of confidentiality, the importance of being professional, such as perhaps not using your phone and having a personal chat when you're with a patient, introducing yourself as a student, just general, very sort of simple things really, but are not always obvious to students. And we also sort out practical things like IT access, so that they have access to the internet, the intranet, and email, and anything else. We give them time to discuss any worries or issues that they might, want to talk about that they haven't spoken about in university, but now they're out, reality's hit. Oh my God, what time do I start? What time do I finish? When do I wear my uniform? When do you not wear your uniform? All sorts of issues come up. And I think my role is just to support them and sort of help and advise for whatever comes up. I think a good mentor is someone that welcomes the student into their area and makes them feel comfortable, but actually stick to procedure in a way, to undertake things that they have to, is a basic minimum. So they need to have a first interview with the student within the first week, and then plan in a midway and an end interview, and really facilitate the learning. So the first interview would be to get to know the student, to actually see what they've done in the past, what they want to do, what they want to achieve while they're there, and perhaps identify areas that maybe deficits, not because it's the student's fault, but perhaps they haven't had experience of certain things that they may be able to achieve in this placement. So it's a getting to know, making them feel comfortable, introducing them to the team so that they're in a good learning environment for learning, so they're comfortable. And then actually working alongside students, supervising, making sure they're safe, building up their confidence and competence, so that, you know, at the end result is what we want are nurses that are going to be looking after you and I. So that's what we're aiming for, good nurses, caring nurses. I think students need to be very proactive in their learning. They need to ask lots of questions. They need to ask for help as early as possible. And there's lots of people that are willing to help. They have the mentors, practice facilitators, we have link tutors, we have personal tutors. We're all there to help, and we all want students to achieve. We want them to succeed. So, you know, asking for help is what we want them to do, nice and early.